This is America. I am 60 years old and have no health care.
How many of you have some kind of medical thing you need to do, but you can't afford it?
This is what our shitty ass healthcare has come to, where my patients need medicine and supplies and their insurance won't cover it, and here I am.
Yesterday, I got the surprise of a lifetime. I am being sued for a hospital bill.
This is what happens if you don't pay your medical bills in America. You basically have 30 days to pay your medical bills, and they will call you and basically harass you every single day to pay your bill.
In 2 months, it's going to become completely unaffordable to live in the United States. And I'm not talking about luxury lifestyle. I'm talking about basic middle-class needs.
This is how much my insurance paid. Out of that, that's how much my insurance paid.
I'm still very highly debating getting like a weekend job to help pay my bills.
In America today, getting sick feels like a financial death sentence. A simple hospital visit can cost thousands, a broken bone, tens of thousands. And a cancer diagnosis can destroy a family, not just emotionally, but financially. People aren't dying because of the illness itself. They're dying because they can't afford the treatment. The system tells them to get help, but every step toward help comes with another bill. Insurance premiums rise, coverage shrinks, and hospitals demand upfront payments before even touching a patient. In the richest country on earth, survival has a price tag. Let's dive into the video and see how people are suffering because of this broken system.
So since I'm feeling really irritated, and I have been feeling irritated for 2 days, I'm going to do another post related to how well we're doing or not doing. How many of you have some kind of medical thing you need to do, but you can't afford it? Just curious. Let's take a poll. How many of you have something that you need to have done that you can't do? I'll go first. I have some kind of thing going on with my right arm, and I most likely probably need surgery because I think it's related to the ulnar or radial nerve, and I can barely raise my right arm. But I also have a shoulder that needs to be replaced, and neither of which I can afford to even go to the doctor to have assessed because I can't afford just the office visit copay, let alone the surgery copay. And then my doctor ordered me one medication recently, which the insurance decided I didn't need and they weren't going to cover, and it's $500 a month. So I had to decline it because I can't afford it. So now it's your turn. What are you not doing?
This is America. I am 60 years old and have no health care. None. I'm helping take care of my parents, so I had to take a leave of absence from my job. The Affordable Care Act for me is $472 a month, and I surely can't afford that with no job. And I just want you to know there's a lot of us out there. Do you have health care? I can't believe I don't have health care. At 60.
This is what our shitty ass healthcare has come to, where my patients need medicine and supplies and their insurance won't cover it, and here I am spending my own money because my patient needs it, and he doesn't have any money and he can't work. And the insurance won't even cover what he needs. And I'm sad and I'm sick and tired of it.
Across America, medical debt has become the new pandemic. Over 100 million people are trapped in it, from unpaid ER bills to surprise ambulance fees. People are cutting pills in half, skipping checkups, ignoring pain, all to avoid another invoice. Parents choose between buying groceries and paying for their child's inhaler. Seniors delay surgeries because they can't cover the copay. And when they can't pay, collection agencies come knocking. Ruined credit, lost homes, broken hope. Debt collectors profit off sickness in a nation that calls itself free.
Yesterday, I got the surprise of a lifetime. I am being sued for a hospital bill. How much am I being sued for? $5,443.57. So TikTok, I need y'all's help. I have never asked anybody to send me money, and I'm not asking anybody to send me money. All I am asking you to do is to like this video, comment on this video, favorite this video, and apparently sharing this video helps it the most. Because I have called this hospital and I have said, can we work out a deal? And they said, nope, not interested. Which is really weird because my husband went to a hospital in that general area at one point and he qualified for a discount, but they're saying our income does not qualify for a discount at their medical center. And I'm slightly freaking out because not only is my child's birthday in a few days, there is then Thanksgiving and then there is Christmas. Nobody has $5,400 to just be coming out of pocket for a medical bill whenever the hospital didn't even do anything for me. They literally said, your gallbladder needs to be removed. Go home. So that's fun. But I did the math. If 4.5 million people view this video, I could potentially pay this off. I don't think we'll get there, but I would love to see how close we can get and then see if they are willing to settle for like half if I can pay it up front. And I will keep y'all updated on if this video is able to help me do that. Welcome to America.
Story time for another reason propaganda I am not falling for is that the U.S. healthcare system is anything but a joke and a for-profit scam. The story involves my son, who is currently studying abroad in South Korea, and this story all happened, keep this in mind, throughout my night last night. So his day, my night. So I read this entire story when I woke up this morning, and it all happened within one day for him. I'm a registered nurse, and I advocate for patients in the insanity of the healthcare system that is the United States. I also work in home health. Follow me for home health and advocacy tips if you so wish. Okay, now to the story. My son realized during one of his classes that his eyes have worsened significantly. He couldn't see whatever he couldn't see. And so that was the first text that I received. It's like, Mom, my eyes are so bad. And again, this is like whatever o'clock in the morning for me. So I'm sleeping. And then progressively he sends what's going on through text messages that I'm seeing the next morning. And it's that he went to get his eyes checked. And then pictures of him getting his eyes checked. And then the final picture was him wearing the glasses. And like, okay, I can see now. So you're telling me my 20-year-old son found an optometrist, went in immediately, got an appointment, got his eyes checked, not only got a prescription, was told to come back within 2 hours and had his glasses. So before I even woke up the next morning, I had the final update. Not only that, he paid $70. And that was because he didn't have yet the student insurance that he's gonna have, which is like $40 a month. That's gonna cover his health care while he's there. It's one thing to know how corrupt and ridiculous the healthcare system in the United States is, but it's another thing to see and hear with, and it makes you wonder if your 20-year-old here in the United States decided that they needed to go get their eyes checked. Think about that process. Getting the appointment. Then you're finally there. all of the different things are going to be like, oh, that's not covered, that's not covered. And then when you get your prescription, you're having to choose, and then it's only going to cover, 20% of it. And then you're going to try, these glasses are more expensive, and then it's going to take 2 weeks for them to be mailed. No. While I was sleeping last night, my son was able to accomplish it all. It's absurd.
I just need to complain for 1 second about our godforsaken healthcare system. Okay, so about 3 weeks ago, almost 3 weeks ago, maybe a little more than 3 weeks ago, I overextended my right ankle, like the back, like the Achilles tendon area. My amazing kitty tripped me when I was going up the stairs to the basement or from the basement, and hello, there he is. Thank you, that amazing kitty. I overextended my ankle while I was trying to regain my balance. Since then, it has been increasingly painful, but I don't go to the doctor for myself because, for one, I don't have the time with the kids and work and everything else. It's hard for me to take time out of my day to do those things. But for two, even if I wanted to go to the doctor, I can't afford to. So I am making, in my professional career right now, I am making more than I ever have previously in the other jobs, which makes sense because I've been at this place for almost 9 years, and I have a role in management, and my salary it's decent, but I'm still, with having kids and a mortgage and the bills and all of that, I'm still very highly debating getting like a weekend job to help pay my bills. So I'm not rolling in dough by any means. But I do have health insurance through my place of employment. So I pay my insurance every paycheck. I have a pretty high deductible, so there's that. But when I had COVID back in January and I went to urgent care to get swabbed, after insurance, I paid over $500 out of my pocket for that COVID test. And I get it. I work in healthcare, animal healthcare, but healthcare nonetheless. So I get that there's a fee. You go to the clinic and the technician does the swab, and then you have to pay for the doctor's time, and then you have to pay for the lab charges, and the clinic then has to pay the lab for them to run the tests, and they have to recoup those costs. I get how all of that works, but I can't afford, as a 38-year-old woman, I can't afford to go to the doctor to have my ankle looked at because they're going to want to take an x-ray. They're going to want to do all of the things. And I simply just can't afford it. I can't afford to have it looked at. And don't come at me. I know you're going to come in the comments and say the more I walk on it and the more I do all the activities on it, I'm just going to make it worse. I know all of that. And I'm not going to be able to afford to get it fixed at that point either. This is more for me to vent and kind of bitch and moan at the godforsaken state that our shitty country is in when it comes to, their citizens and healthcare and all of the things. It should not cost me $500 out of pocket for a COVID test when I have insurance. I don't get it. I don't get it. And I need it looked at. It hurts. I'm still doing the things. I went to my first workout class yesterday, and I was just kind of took it easy on that side. And so I'm not letting it ruin my life, but it is increasingly painful. And I know that there's something wrong with it. And it just sucks because I can't physically afford to go to the doctor. How are other people making this happen? How do you prioritize your own health care? What are you doing? What are you doing to afford to go to the doctor? Because I need those tips and tricks. It's getting bad. It's getting bad. It makes a crunchy noise when it's bad. So help me. What do you do? How are you affording to live right now?
This is what happens if you don't pay your medical bills in America. You basically have 30 days to pay your medical bills, and they will call you and basically harass you every single day to pay your bill. After it's been 60 to 90 days, they will sell your medical bill to a collections agency where your medical bill will start gaining interest, And from there, they will also start harassing and calling you and basically telling you to pay your bill. Depending on how impatient your collections agency is, they can take you to court and sue you, and they can go after your wages, your paychecks, your car, your home, until that medical bill is paid off. It also really depends on the amount too. Like, I don't think they're going to take someone to court for a $100 bill. I know that your medical bills can't affect your credit score, but once they do sell it to a collections agency, that's when it can. However, a lot of people actually don't know this, but you can actually negotiate your bill and by a lot, like half the cost, because at the end of the day, all they want is your money. You can also do this with your collections agency too. You can also do monthly payments too, and as long as you're making monthly payments on your bill, they can't come after you. So you can literally pay $1 a month and they can't come after you. Usually if you don't have insurance, there's usually charities that will help cover your costs. Even the hospital themselves will give you a discount if you don't have insurance. I know there's a lot of people that will say that their medical bill disappeared without paying for it. That's because either the collection agency gave up the cost of it, like you probably just owed like $100 and they're like, it's whatever. Or because they're gonna come after you years later once your bill has gained a lot of interest. So yeah, that's basically what happens if you don't pay your medical bills in America, unfortunately.
So you're being told that there's a policy in place that...
Tanya, can you come here about the new talk to this patient?
Oh, I just want, so you guys are being told that you guys have a new policy that if they don't pay even partial the copay, they can't get any of the stuff that the doctor orders. So any schedule.
You have to pay your copay, your co-insurance, and
I couldn't hear you because there's 15,000 children.
Any test that was scheduled, you do have to pay it out.
Even with a doctor's prescription. Wow, you guys are gonna lose a lot of business because
actually patients have been paying.
Yeah, I'll drive to Altoona next time. I'd rather go there, but I was just curious because I want to talk to a couple of lawyers about that.
Halfway down that hallway on the right-hand side is the lab.
Behind every statistic is a face: a mother skipping treatment to save money for her children, a veteran rationing insulin, a father who lost his home after one emergency surgery. These aren't isolated tragedies, they are the reality for millions. Healthcare should be about saving lives, not selling them. But in America, to live, you must pay. And if you can't pay, you simply don't get to live. This is the American healthcare collapse,